Thanks for having me, NewYorkBIO. I'll be honest, I've been a little conflicted about this, and I'll explain why. Really for two reasons. Dr. Zamudia, Bradley Watt, Brian Long, I'm not competing with these guys, I'm going to be honest with you. Incredible stories. I am a chronic disease patient. I have something that's called ankylosing spondylitis, or as my rheumatologist likes to say, or something like that. So not fully diagnosed, but definitely something autoimmune related. I had some issues even as a teenager with back pain and stuff like that, but obviously at that age you don't really think that there's a disease there. But as I approached my mid to late 20s, there was a few events where clearly something wasn't right. And like most people that have these types of conditions, I went through the normal cycling of specialists and treatments and physical therapists, which, by the way, you got to do background checks on some of these physical therapists. I had one that was a masochist. She loved putting me through torture. I was red-faced, tears. She's like, do more, it's good for you. And I was just like, I was hurting bad. That actually turned me off from seeking treatment for a while. And then I saw a podiatrist who actually gave me some orthotics, and that helped quite a bit. It got me to the point where I was able to get back into fitness and run. And keep in mind, I still don't even know what I have. And I got to the point where I was even running the New York Marathon, and I know this came up earlier. I was running the New York Marathon around mile 5. I had some really bad pain in my ankle, and I got to the Queensboro Bridge, and everybody's taking selfies, and I'm texting my family, I'm like, I'm hurt. And when you get to that point where everybody's emotional, I was crying, but not for the same reason everybody else was. I was hurting really bad in pain. But it was interesting, that experience, that injury led to me actually getting my diagnosis, because when they did an x-ray, they saw that I have a tendon around my ankle that's, well, everybody has this tendon, but mine looked like a bone. I've been calcifying. So I go and see a rheumatologist, and again, I get it might be ankylosing spondylitis or something like that. And he's like, really the best medicine for you is exercise. And so I was all about it, got back into it, decided to reignite my illustrious high school soccer career, which was subpar, but I ruptured my Achilles. And I know this came up earlier too about mental health and chronic diseases, and let me tell you, rupturing my Achilles, that recovery emotionally was far harder than the physical part. It's a bad injury, but I tell you, that sunk me into a depression that I'm still getting out of. That's real. So anyway, I go back to the rheumatologist, and he starts looking at my joints, and he's like, yeah, I think you're more susceptible to rupture. I was like, all right, thanks for that. So that's where I am today. But the other reason why I was a little conflicted about this is because I've never been into patient advocacy for me. In some ways, patient advocacy sought me out. I was in industry for over a decade and had all intentions on starting my own business. And as I was getting started, I was getting some calls from some folks, patients who were in really hard shape, typically some issue with a federal agency of some kind. And it just became clear that the next chapter in my life was going to be patient advocacy. So if it's okay with you, rather than focusing on my story, I'd actually rather share a little bit more about the people that I've interacted with and the people that I fight for, frankly. One of the first calls that I got was from a very small organization who had a mom named Denise. They were just moving back to their home state of Arizona, Phoenix area. Her son Woodrow had a very ultra-rare degenerative disease, terrible disease. 6 months old, he was diagnosed, and the challenge was they were trying to get into the compassionate use program, and the FDA wouldn't let him in because he didn't meet the weight requirements. And so, rare disease moms, you don't mess with them, right? And so she wouldn't stop. She was relentless. We worked with her to get her members of Congress engaged, and finally the FDA relented. We were able to get Woodrow into the compassionate use program, and I'm happy to say he's 5 years old today, and that's significant because that 5-year mark is typically the death milestone, unfortunately. And there's many kids like this that have done very well, but the sad part is the treatment that they're on in the current regulatory framework has no path forward. They were hoping, everything has to be the placebo-controlled trials, which is a death sentence for a lot of these kids. And they were trying to use natural history as a comparator, but the NIH study didn't meet the standards of the FDA. And so they're in limbo, and it's really sad. About a year ago, I met a woman named Lindsay in Charlotte, North Carolina. She has a chronic neurological condition, and she was one of these people that every year, same insurance, every year was forced to go through the prior authorization. January rolls around, got to go through the prior auth again. Big win for her was finally getting the insurance company to agree. Now, I've heard this story actually quite a bit, but the one thing that really struck me was this. She told me that she felt like she was living in this toxic work environment. And I was like, well, why don't you change your job? And she's like, if I change my job, I have to change my insurance. And to her, that was like Russian roulette. And then finally, I want to talk about Ian from New York. I met him almost a year ago exactly as well. He's a young guy. He has a few different illnesses that just makes him particularly vulnerable from a medical perspective. And he's relying on Medicaid. And Social Security Disability Administration actually, out of the blue, knocked him off the Medicaid rolls. And basically, the judge told him he wasn't disabled enough. He went to federal court. I really applaud this guy. He went to federal court and took this all the way and won finally. And the judge said to him, one not need to be an invalid to be considered disabled. These are examples of the struggle that so many people are going through around the country. And I'm just gonna be real candid, I tend to be a little blunt. All aspects of the healthcare system are failing these folks. I'm not getting into politics here, that's not what I want to do, but I'm telling you, federal agencies, private sector, the social sector is not working for these folks. So I also want to focus though, I always like to try to find the silver lining, try to find the hope, where there's problems, and there is. Andy Schoonover, his daughter had to have a routine ear surgery a few years back, and the insurance company denied him coverage. It was about an $8,000 medical bill that they considered medically unnecessary. They obviously didn't have it. It was a real struggle for them, and so he created a company called Crowd Health. It's not insurance, it's just people. People giving to people. No networks, no insurance, no bureaucracy. If you're in need, they come and help. Steve Lee, he watched his mother struggle with a serious mental illness. And he realized, and many probably see this, it's very hard to get mental health care. Try to find doctors, really hard. He figured that it needed to be democratized and more accessible to people, and he and his brother created a platform called Aura AI, or Aura Health, I'm sorry. This is really cool. So it's AI plus wellness, and they use professionals, mental health professionals, as content creators, and they've built this great repository, this great library of wellness services, and they're able to tailor care to you based on your interests and based on your needs. They have 8 million subscribers, and I think that's an incredible example of really innovative thinking. And then my friend, Dr. Jonathan Weiss, he just asked a radical question of how can we get patients to shop on cost and quality like anything else we do in the world? He created something called Health Engine. This is really cool. If you need a surgery, let's say a knee surgery or something like that, he's got this worked out so that the health systems are bidding for you instead. He does this for labs, again, procedures, all sorts of things actually. And the cool thing is, he's getting costs below the negotiated rebates of the insurance companies. So the insurance companies are getting paid, the health system, they have, by the way, all this available space in their hospitals that's not being used. It's making good use of their space. And by the way, there's savings left over that they're able to give it back to the patient, and it covers their out-of-pocket costs. In some cases, they've actually made some money on the surgery, which is pretty cool. So anyway, I just share these because I sense there's this concept that you hear from the health plans, right? That nobody wants to be Nobody wants to shop for care. I've come to the conclusion nobody wants to shop for care through them. And the reason for that is just the fundamental issues with the way that we've conducted healthcare in this country, right? Everybody's spending everybody else's money, and every transaction has to be approved by a bureaucrat. So what is your incentive to actually take an active role? Very little. But what we see through these examples is when you give people an opportunity to actually engage in their healthcare, they're willing to take it. And so I just kind of want to conclude on a few different things that I've been thinking about lately, because the biggest challenge for all of these organizations that I mentioned is we're in this system that has years and years of laws and regulations that have basically made it so to be a startup is very hard to compete, right? How do we break that open so that we can actually empower patients again? And so I have a few things that I want to share. I'm not going to say that they're easy, but I do think they're fundamental. Number one, I think we need to acknowledge that this third-party payment structure is not working well for anybody. Well, maybe for some, but it's not working well for the people that matter. Patients, doctors, pharmacists, the people that are really in the middle of it, it's really struggling for. I think it's time to have the conversation about funding people, not insurance companies. And everybody's like, how do you do that? It's possible. And I'll be the first to admit, when somebody first talked to me about this, I kind of rolled my eyes at it. But I've kind of become a believer in it. If you set things up where you have enhanced health savings accounts, it actually can be a really powerful tool that can have people be more active in their healthcare. And this doesn't have to be a tool just for the wealthy. There's actually bipartisan legislation in Congress right now that would make health savings accounts available to 93% of Americans. There's another piece of legislation that would give the lower income Americans the opportunity to take their subsidy from the Affordable Care Act and take it and put it into a HSA rather than give it to the insurance company. It would be their choice, their option, and they could use it as they see fit. I think the other thing that's really important is looking at things that, like health reimbursement arrangements with employers. I think employers can play a massive role, especially a lot of employers in this country. They don't mean to not be into healthcare. It's not their primary business. I'm not talking about the largest companies in the world. I'm talking about kind of the mid and small size businesses. Putting money in the hands of your employees to let them design and pick the health plan that works for them is an incredibly great opportunity. And when you put more people in the marketplace, that's going to force the insurance companies to compete for your business. They're going to want you to be loyal to them, and they're going to have a reason, because right now, the patient isn't the customer, right? They're the byproduct, basically. The other thing is, and we talked about this a little bit on the panel before, is I think it's so important that we start to define charity care and strengthen the safety net. Right now, nonprofit hospitals are not accountable for demonstrating how their tax benefits are applied to investments in the communities that they serve. This isn't easy because nothing's easy in Congress, but there is some interest, bipartisan, talk to both sides, in starting to define what is charity care and be far more clear about what it is for community benefit. And going back to the last panel, I would double down if you're involved in a federal charity care program like 340B. And just to answer the questions on the FQHCs, the Ryan White clinics, their transparency standards are already higher than the entities we're talking about. Nobody's going after them, right? But a patient has the right to know how charity care resources are being applied to people in need and the communities that they're supposed to serve. And then finally, just to kind of make things quick, I think we really need to unleash American innovation. As I mentioned before, we need to reevaluate sort of the laws and regulations that are blocking all this competition. Everything from certificate of need, scope of practice, the opaque billing, all of this stuff is from a system that was designed in the mid-20th century. Science, health, technology, even finance has completely transformed since then. And I believe in the 1950s, it was designed with best intent in mind, but it's not designed to meet the needs that we're at today. And so that's the final thing that I want to ask you guys, because this is where I really need some help. I don't have all the answers, but I do believe that there is an answer in realigning the incentives to focus on the long-term health and well-being of people. And I look at things like gene therapy, transformative treatments that can change the life of people, and we all know, I'm sure everybody in this room knows, they don't fit into this current financing structure. And I don't think we should try to force fit it. I think it is an opportunity to reimagine how we finance healthcare in the 21st century. And my hope, my ask is with our industry partners, when we do this, let's not just think about gene therapy, let's think about how we can refinance the entire system. And so I'll just leave you with that there's too many people that I meet every day that healthcare is a fight for survival. And I think we're at a pivotal point in time where if we don't start making very difficult decisions and reevaluate the conventions that we've been dealt with over the course of a century of healthcare, the system's going to collapse. I hate to be the doom and gloom about this, but I really do think we have 10 years to get this right. I really do. And so I'm with compassion. Again, I think the incentives, long-term health and well-being of people, and I just want to point out too, I think this is why we have to address this chronic disease epidemic, especially the ones that are preventable and the ones that we can get people back to near perfect health, because that is resources that we should be applying to rare diseases, the most difficult diseases that are out there to treat. That's where my heart is. I mean, my heart's with everybody, but that's where we really need to invest the dollars. But it's being consumed by chronic disease. And so I really think we need to take the opportunity to really focus on getting that under control and then reinvest it so that we can help all patients rise up. Thank you very much for your time. I really appreciate it. Thank you for the applause.